Archaeologists analyzed in the laboratories fragments from ancient altars covered by sandstones or volcanic ash. A surprising result caught my attention. Along with the fragments of the sacrifices, which sometimes also contain human remains, there are traces of plants with psychoactive effects. In fact, traces of drugs. The smoke of these plants produced a euphoria to those present, which they believed was due to the goodwill of the gods. The priests lied on purpose while breathing the smoke from the altar installed addiction. Gradually, the repeated return to these altars brought enormous financial income to the priests. Nothing new, and today drugs offer the illusion of getting rid of problems, promise a false state of well-being, install addiction, and begin the gradual destruction of the body and irrevocably the mind. Drugs destroy lives and ruin families. Welcome to Steps in Recovery, a program where we want to convey hope to people struggling in their addiction, to bring hope to their families, and in the same time raise awareness about what it means to get addicted to drugs. Also, we hope that people will understand the importance of preventing using drugs. I'm here. My name is MargiAnne Isaia. I'm a licensed professional clinical counselor, and I am glad to introduce you my guest, Marissa Partee. Welcome back, Marissa.
Hi, thank you for having me.
Marissa is a behavioral health specialist and addiction counselor, and today we'll continue our discussion about recovery. And in order to understand recovery, we discussed the previous session about the importance of teamwork and what is about cravings and triggers. Today we'll move further and discuss about prevention, relapse prevention. And as in medicine, we have primary prevention. Here we have also secondary prevention. The best approach will be to provide education in order to prevent using substances, to prevent any addiction. And also, if people started using drugs, we want to give them hope. Let's talk about relapse prevention. You used substances, you are in a treatment program, you became abstinent. We are looking forward to having long-term sobriety. But in the process, people fall back and relapse. What defines a relapse?
So when we look at relapse, we have to keep in mind that relapse is a process. Bottom line, it's a process. What we're seeing is that there's actual stages now of relapses. There's 3 parts that are in this process of a relapse. The first part is commonly known as the emotional relapse. This is where we're identifying where our emotions are kind of contributing to old habits before an actual use. So first we see an emotional relapse. The second stage we see is the cognitive relapse. That's when the thoughts start to occur. That's when we consider using again, and we're justifying it in our thoughts. Then the last stage we see in relapse is the physical part of it. That's the action of relapsing. So we see that a lot of times we can intervene at that earliest stage. They say that at the emotional stage we should intervene because we have the ability to minimize that craving that's driving that desire. And it's also seen that the longer we wait to intervene, whether that's the client or with the clinician, you're more than likely to have that client relapse because that craving is just so enhanced and they are naturally doing what they know to do, which is to self-medicate.
Yeah, when you are talking about this, I remember a client who said, yeah, I started feeling this way and say, I was here, the counselor was there. We are waiting for you to talk. Yeah, but I talk with my peer.
And that's where I see that happen a lot. It's that connection with others that are sharing the similar experience. And I support that, but there are limitations to it because I want to make sure that the client is using the appropriate resources. This is where that collaboration of all the different professionals is really important, because then we can be as a team to really help that person. So I do see it happen at that emotional stage. I like educating as a counselor how important these different stages are to help them identify whether they're in the clinic with me when they're experiencing that, or outside the clinic they can recognize and they can reflect and capture it, so then we can work on, okay, so when you're triggered by dealing with your parents, you know, what can we do to intervene in that moment? So it's a plan. So with relapse prevention, it comes down to early preparation. But using what you know from previous decisions and mistakes that we're not happy with to then shift, okay, what can I do the next time I face something like this? Because there's a good chance you're going to have similar triggers again.
And I like, because you said something about the parents. And this is the point of us emphasizing the thing that we work with the individual, and we work with the family, because the client was sober for, let's say, 3 months, and he goes back to parents. And we see the importance of having the family involved in the process, because otherwise the risks for relapsing are huge if the family is not prepared to handle.
And I do have a lot of instances where I've experienced that, where I've had a client in a controlled environment, so they go into a residential treatment setting, they're there for 30 days, they make great progress and they're impressed with themselves, but then the real test is, okay, now they're going back to their families, they're going back to these old environments, but what's changed there, right? So I do think it does help if there is some services and there is some therapy started with the family dynamic. Like, that's such a big component to maintaining recovery, is working on that protective factor, because that's what it is. It's their family being a protective factor rather than a risk factor, and having them being able to amplify their support in the home.
A particular sensitive time for people in recovery, when you think the risk of relapsing is high, what you might say from your experience and from the books?
I like to, before anybody even starts to go back to, say they're leaving residential or they're going to be around very similar environments and people, I like to prepare all of that ahead. So I like doing discussions and having sessions regarding common dilemmas that we face in recovery. This always helps me plant a seed with that client, even though they may feel, oh, I'm not going to deal with that. That discussion invokes mindfulness. So in case they do, they've already had a discussion about it to kind of think about what they would do to navigate through that. So I see a lot of them when it comes to family is the biggest one. It is family. They can go through their circle of friends and their support systems and, you know, take people out and pull people in. But when it comes to family, I see it being very difficult for these clients to maintain. So if there's lack of therapy in that dynamic, it makes it very challenging for that client to maintain any recovery success.
I can see now, and people might understand that this is the reality of the struggle people have and the need of not rushing through the process. Oh, I'm done, I'm going home. You mentioned about control environment. It means in the first 30 days, at least first 30 days, you are in a controlled environment. We have here in the United States the residential treatments program. Somebody is there with you 24 hours, and you can talk, you can reach out for help. But when you move in the outpatient and you don't have this time of observation, now you are with yourself and in charge of your emotions and starting a new life, which is really, really scary. Some people said, I didn't relapse, I just used a little bit and then I went back. The difference between lapse and relapse.
So it's really hard to decipher and honestly support the difference between a lapse and a relapse. So all in all, different perspectives change and shift that.
Mm-hmm.
But for me, in my perspective, in my counseling lens, a relapse is a relapse. If your intent was to go out there to numb yourself, self-medicate, not feel, whether it was one time, a few times, it should be considered a relapse because it needs to be recognized. Maybe that work hadn't been done as much as we thought, you know? So there's that vital information as a counselor I need too, because maybe they are needing more aspects to their foundation. So this is where I bring in 12-step support. I start suggesting a sponsor. I start suggesting more meetings, 12-step meetings, being involved in the 12-step community, and really being with people that walk and talk recovery a little bit more.
You're talking, and I have clients after clients come, but I didn't took just this much, and this just was, this is not relapse. You said when you took the substance, you are sober, and then you go just this much, to use it as like a band-aid to medicate some feelings.
It is a band-aid.
This is relapse.
It is. And what it comes down to too, when I see that occur, it bottom line, when someone tries to justify it was one time, it was just a little bit, they're starting their addiction from square zero. So what we're seeing is the pattern of denial. It's spark denial. With as much as they may have known and they've gained insight on, just that one time, just that small amount, that's the disease of addiction. The denial sets in, and then we're not able to recognize it until we maintain that abstinence for continuous days where we're able to really cognitively reflect appropriately, like, okay, that was a mistake, that was a relapse. I do have to start a little bit further than I want to so I can get more work done.
Yeah, and this is what I understood over the years, that the longer you stay sober, the risk of remaining abstinent are greater. Statistics said that 40-60 of addicts relapse within the 30 days after treatment, and up to 85 relapse within the first year of recovery. Very disappointing for clients, for families. What about professional?
Yes, it does feel like we're not as effective as we should be, but those, and this is something I battle with colleagues, where they personalize, there's that transference, right, where they feel like it's their fault, like they're holding on to the blame on what's happening. But with me and my approach, I need that information. I do. I need to know that somebody can't maintain 15 days of sobriety, because then again, that gives me information I need to do that motivational interviewing approach to really help break through kind of their thinking and what they're really trying to achieve, and to show them what they're doing to support that. Is it really supporting the goals, or is it pushing them further from those goals?
Yeah, and now because this program needs to be paid for, who is paying? And this is very expensive, and this is why we need to emphasize the need of prevention. Because it will help so much. And it's about saving lives, it's saving potential. The fact from United States of America, more money goes toward recovery, criminal behavior, than they go toward education.
Absolutely.
It is so, so sad.
It is.
My experience with clients who relapse, I say, maybe the therapist didn't do his job.
Right.
And I learned that is a complex of factors, and we need to know where to stand, because otherwise you don't have motivation to work there.
It even goes back to, if there's no motivation, you're doing it for somebody else. And from what I've learned, if you're not doing it for yourself, you're going to struggle 10 times harder until you can do it for yourself. So that's where the family pressure comes in, you know. The family is to a point where they can't deal with all of the antics that are coming from the addict behavior, but then at the same time, the lack of knowledge and insight for the family too sets these high expectations for somebody in recovery that sets them up for something that they're not going to attain. So that's why I think therapy for that family dynamic is really powerful, because knowledge is power. So then they know how to be that support system, just like the client got in that controlled environment.
I remember parents calling, what kind of program is this? What you are doing there is not enough. I said, okay, thank you. I really, really feel sorry. Try to validate them. I said, I think you need to go and have your own therapy.
Yes.
And we'll talk about family therapy and family involved therapy, because it was a client, I have this client in my mind. Mother who was in her recovery wanted me to do therapy for her. I say, you need to go to your own therapy, and she started doing. Okay. And finally the dynamics changed, and it was helpful. Parents might say, you relapse, you are so weak. It's like, no, like, you're not a man. It's something missing. It's like moral weakness.
Yeah.
So how you comment on this?
That just, hearing that, because I hear that sadly quite a bit working with clients and then working with families. I know the experience we shared at the company we were at, we worked with young adults that still were living with their families, so they were naturally involved. And I would hear that a lot. But what that reminds me of is lack of knowledge, because that's not the reality. If you have an understanding of how the disease of addiction works, you're more likely to be empathetic, you're more likely to be supportive in different ways. So it comes down to them not having the appropriate information they need, which I've always admired about you, Margie. You did always redirect parents to get independent services. And I also like to see something that I have witnessed where I'm at now is a family support group they offer. And I love hearing families being a part of that, especially nearing an end of a client ending treatment with us. I love seeing the families gather in those support groups so they know how to be effective at home.
I enjoy it whenever you have the client, and we'll talk also about what's going on in the family. What I learn from clients when they get sober, relapse, get sober, relapse. What's the risk of using the substance? Because you said, I use this much and I know it won't hurt. Any experience you have?
I feel like no matter what amount it is, whether it's one time or 1,000 times, it's hurtful. It's going to damage how our body naturally already operates. So you're going to throw everything off if you return just one time, just a little bit. As an addict, and how the disease of addiction works is that's all it takes for us to be set off.
We are in the United States of America, and something really, really, really scary about fentanyl. Because I had clients who said, I knew that I need to take just this much in order to not overdose, because this person had already 3 fentanyl overdoses. And he said just this much, and he went into overdose and woke up in a hospital. And the parents said, you cannot come back and stay with us.
Okay, which are good boundaries, right? We talk about how parents can be more effective with setting boundaries, making sure that they're not enabling and caretaking to that extent with addiction. When it comes to fentanyl, I think at this point in the era we're living in with that, any amount is dangerous. I don't think there's a safe amount. Everybody's already so different with their physiological set, and then there's so much how that's made. It's just a dangerous substance. There's a mixture of just random things, so you're not getting the same thing from every batch. It's random, so there's no way to measure it. There's nothing, and what we're seeing is most people overdosing from it because it's that impactful in our biology. Like it's not meant to be in our bodies. It's not.
Yeah, it's scary. It's scary, and no wonder. I have parents who said they locked me in my room, and I wasn't allowed to get out. I say no wonder, because after 3 fentanyl overdoses,
it's scary.
They are scared.
And we're seeing that even evolutionize. It's not even, so at one point, you know, we have this awareness that fentanyl is in our society and it's a danger. Now it's mutated. There's something called crank, where it's half fentanyl and half muscle relaxer or horse tranquilizer. So it's like even more of a paralyzing effect. So there's even more reason to just don't do it.
Yeah, and I remember, and I keep telling clients, one of my coworkers, she became an addiction counselor because her son, he tried, first time, college student, 21-year-old, and first time, and he died. And she was devastated.
Yes, the potency is incredibly lethal.
It's deadly.
It's lethal. And then what we're seeing with this mutated version of fentanyl is that it's not responding to any of the approaches that they've been using lately when we're using Narcan. Narcan is not responding to this new version of fentanyl. So people are even risking death even more. They're not getting resuscitated with this version of fentanyl.
It's like psychiatrist, addiction medicine specialist.
It's minimizing what options we have for aid. It's a very scary time right now with that.
Scary to get relapse. Why does relapse happen?
There's many reasons it's occurred. I see it happening because, you know, we think about what life used to be. So we start coming up with it's distortions, it's cognitive distortions. We start thinking of what life was like in a very distorted way while we were in our addiction, and we justify why we can try to make it work now. Now we've thought about, you know, the risks and how we can do it. We start almost justifying it, and that would be the cognitive relapse where we're thinking about it, and then we're most likely at that point to go ahead and relapse.
And you brought about the time you stay in therapy, because in the first 30 days, I used to think about cognitive behavioral therapy. It's not working. Maybe after 3 months of recovery, I might go, because their level of cognition is so much affected. And I am more, let's say, more reserved. Let's go with behavioral therapy first month, and then we go with dialectical behavioral therapy, work more emotions, socializing, social skills. And the last and the more sustainable is the cognitive behavioral therapy. But we need a lot of time to be in the program. And somebody needs to pay for the program. And it is very, very expensive. You cannot afford. And no wonder we are in this pandemic, which is more disturbing. It's normal to relapse?
It is very normal to relapse.
This is something to talk about, because people say, you are there, you are sober. What's wrong with you?
Most people relapse. That's just the reality of the process of recovery. And again, without that insight of relapsing, you wouldn't know what your specific triggers are. You wouldn't know where work still needs to be done. I find it so insightful. I know that there's a lot of shame and there's a lot of stigmas against relapses. Like we mentioned, you're not strong enough, you know, but there again defeats the knowledge of how addiction works. It's more than willpower. It's something that's occurring way bigger than that. So it's beyond us controlling it. And I always mention to my clients that the moment we have a thought that, okay, I can control it now, that's already a warning sign that we need to be vocal about, because the whole point of going into recovery, especially if you start working a 12-step program, is the first acknowledgement of knowing that you admit powerlessness, that you have no control over this. So if you then have 3 months of sobriety and you're working a program, but then you think, no, I can control it now, that's a warning sign. Go ahead and speak up to somebody that's in your support services to let them know, I kind of felt like I had a little bit of control over my addiction, to start that discussion.
You brought about the concept of warning signs.
Warning signs.
Warning signs. What is about warning signs?
There's a lot of warning signs, and I think it's going to come down to having that ability to reflect, like I had mentioned in the previous segment, that it comes down to you gaining that insight about yourself. Like, you are your own best expert, and having a team support you through that so you can share what you learn and you know about yourself will help you. The early warning signs is a part of that insight that we gain about ourselves. So we look at, okay, what did I do when I was in my addiction? We look at, was I isolating? Was I reactive? Was I secretive? We look at what feeds our addiction, and it's going to look very different for everybody, but there are some similarities, and those are the early warning signs. That's the stuff that we have to be very mindful of as we're maintaining our recovery. Are those behaviors and habits returning? Because if they are, those are our old behaviors that were connected to our addiction. So that's where we have to intervene. We have to talk to somebody, make sure we're going to our services, make sure we're following through with our psychiatry regimen, therapy regimen, everything that we've built in our foundation. And I always tell my clients, the more you have in your foundation, the stronger your success is going to be. Because if you just do the bare minimum, you just do a little bit here and there, you're ultimately setting yourself up for a bigger struggle and a harder time to maintain your
and
recovery.
It's a lot of learning. Develop new skills, and the old one, you need to reframe everything. It's like a new birth.
It is. It's a new self. It is. And that's a lot of times what I even see with the families. You know, they want this version of us so bad, and we put in that work, and then we attempt to reintroduce ourselves because we're a better version of ourselves, and it's almost unreal, and then we get a little bit of rejection because they're not sure, like, but that comes with making sure that they get the education they need to really support this version that they become.
Yeah, thank you so much for today. The time is flying. We'll move toward what to do, because relapse is part of the process, and we'll talk about this. Thank you for today.
Thank you.
We are glad that you followed our dialogue today. On our part is a way of extending a helping hand to those who listen to us, presenting recovery as a serious, logical, scientific, and very possible action if it is followed step by step. If someone listens to us right now, I'm telling, do not despair. There is hope for you. And for families, there is hope for you as a family. The point is, you need to work together. And God is there to support you if you ask for His help. I'm MargiAnne and Isaia, and together with Marissa Partee, invite you to the future programs.